Building on its historic legacy, the Global Digital Health Summit 2025 stands as the world's most influential platform shaping the future of health and technology. With the World Health Organization as knowledge partner, it is recognized by MedTech as the official pre-summit of the AI Impact Summit 2026. Supported by the Ministry of Ayush, the National Human Rights Commission, the dynamic coalition of the Internet Governance Forum on Digital Health, Digital Economy, Environment and Gaming for Purpose, Bhashini, Denmark as country partner and the government of Telangana as state partner, GDHS 2025 continues to be where vision meets transformation. At Mumbai's Geo World Convention Centre, the GDHS 2025 edition once again became the meeting ground for pioneers redefining global health. From policy to practice, from labs to leadership, the summit was a celebration of ideas that heal, innovate and inspire. With 2,053 leaders from over 30 countries, an expo showcasing frontier technologies and sessions that bridged science and strategy, GDHS 2025 continued to set the global standard for digital health excellence. Day 1 set the tone for transformation, from opening addresses by Dr. Rajendra Pratap Gupta and Dr. Joseph Quedar that reimagined digital health to an inspiring keynote by YS Chi, reminding the world that the true reset demands imagination, risk and creativity. Patients then took center stage for the first time, sharing lived experiences that turned compassion into policy. Through charged discussions with leading global experts on rebuilding broken health systems, public health in the digital age, and the ethics of innovation, experts charted a new course for trust and accountability. The day also witnessed a special keynote address by chief guest Dr. Vint Cerf that moved digital health from conversation to conviction. Day 2 carried the momentum forward under its theme Tech-Driven Implementation Across the Ecosystem. Keynotes by government and global leaders Shri Bharat Lal, Vaidya Rajesh Kotecha, Shri Abhishek Singh, Mr. Amitabh Nag and Dr. Ramcharan set a powerful tone for collaboration and scale. From AI in pharma and medical education to the future of hospitals, wellness and workforce transformation, every session translated ideas into action. As the curtains rose on the third and final day of the Global Digital Health Summit 2025 in Mumbai, the spotlight shifted to startups, breakthrough innovations and global icons shaping the future of healthcare. Under the theme, Scaling Innovations That Matter, ambition and fresh ideas define the conversations, setting the stage for what lies ahead. After 2 power-packed days of engaging sessions and parallel forums, Day 3 brought a new wave of momentum, blending technology, entrepreneurship and even lessons from the world of sports. Day 3 opened with a defining moment in medical history. Bakul Patel, Chair Emeritus of the Summit, and Dr. Rajendra Pratap Gupta, Chairman of GDHS, unveiled the Hippocratic Oath for the digital age. Positioned as a modern credo for healthcare professionals worldwide, it marked a transformative shift in medical ethics.
We are in the knowledge industry. The knowledge is now being supplemented by technology. How do we upskill within the knowledge industry? It's not going from, manual labor to automated labor. It's about within the knowledge industry, how do you upskill?
The summit is about creating the future, and we made it very clear that the golden age of medicine has to come, has a right way technology, and we have to make sure that we help shape it and fast track it. And that's the agenda this year. We're saying reset. Everyone has to reset.
The unveiling set the stage for Dr. Ali Parsa's keynote address, where he charted the future of artificial intelligence in healthcare.
One of the most significant economic shifts over the next few decades will be a transition of some labor from humans to machines. This started with the transition of work, manual, repetitive work to robots. Our factories got decimated. In the West, we are today arguing to bring these factories back, bring our jobs back. It is true that these factories may come back, but the jobs will go to the robots, as much of what can be done in a factory has now been turned into the hands of the robots.
As health systems go digital, cybersecurity has emerged as one of the sector's most urgent challenges. A dedicated workshop addressed the risks and strategies to protect sensitive patient data.
Why cyber attack takes place at the first time? Why somebody plans a cyber attack? This is what it represents. So it can be cybercrime, that there are bad guys who are trying to create some attack on your organization because they want to have money. They want to gain some money from you as a part of ransom or something else. Then there is activism, which is not about money, it is about ideas, the ideological war. If we don't agree with the idea of a specific community, the next thing that is happening these days is the cyber attack.
Up next, innovators from across the globe shared breakthrough approaches to managing chronic diseases, from neuroscience to gamified health solutions.
Most of the impact that wearables have had on us and to continue to have today are on people that are already motivated to do a better job with their health. It's, again, feedback loops are wonderful. I can't live without them now. But somehow the people that are chronically ill, many of them have not engaged with that notion of using feedback loops to improve their health.
What if I told you that we could move screening and diagnosis of autism from the subjective realm into objective biology? And that's what I'm going to talk with you about today, the Get Set Early eye tracking test battery that I developed, where basically a baby sits in front of a computer screen, watches some movies, and then after they're done watching around 6 movies, it takes around 9 to 12 minutes, a score emerges on the screen for the technician to see that tells the technician if the baby falls in the autism risk range.
We predict that the healthcare industry market is going to be around 50 billion in few years. And this is driven by scientific evidence, commercial evidence, and institutional attitude change. So the healthcare psychology is based on the game psychology. So you introduce the challenge, you face new health information, you have tutorial, you play, then you get the reward. If you do it right, you can have change in understanding and attitudes, and you can make a behavior change.
Now, chronic disease is something that stays forever, but the applications that we're building for it is actually experiencing transient retention. Chronic diseases requires long-term engagement. It requires digital platforms to hold users and engage users meaningfully beyond weeks. The retention rate currently is less than 10%.
After a morning of discussions on innovation and security, delegates turned to skill building. At the Global Digital Health Summit, the Level 1 AI certification workshop brought the power of creation to everyone in the room. From building chatbots to designing mobile apps with Gemini, participants discovered that even without coding skills, they could turn bold ideas into working digital health solutions.
When machines are going to write code, it's the idea and what you put into the code to ask it to build is your intellectual property. You could make a tool to learn from your data set, and that could be your intellectual property as well. So I think some of the principles will stay. Some of the things we assumed in the past may not.
Patients seek information all the time, sometimes at ungodly hours in the night. So we are using many sources of online information to identify health information. And you qualified doctors cannot be available 24/7 to answer our queries, answer the queries of your patients. So you need assistance, right? What better assistance than AI, which never tires?
The certification workshop empowered participants to take their first steps in AI for healthcare, ensuring the workforce is ready for a tech-driven future. The highlight of the afternoon was a special keynote and fireside chat with cricketing legend Ajinkya Rahane, who brought lessons from the field into the world of healthcare innovation. In conversation with the summit chair, Dr. Rajendra Pratap Gupta, Rahane reflected on resilience, teamwork and leadership.
If you're traveling in a local train, timing is key. those who understand cricket here, it's not about batting timing. It's actual time on the clock. You miss a train and your entire schedule goes for a toss. So this discipline, along with my single-minded goal to play for India, represent India, what carried me through in my younger days. When you're starting out and trying to make a name for yourself, not just in sport, but also in any other field, you face rejection. But how you come back from that, how you handle that actually defines your character and your path ahead.
Whether you are in academia, whether you are in the industry, whether you are a startup founder, whether you are a policymaker, vision has to be there, the seed has to be there. And this is something I learned. People always keep telling, which is shared with me, passion builds up, but vision has to be there. From the very beginning, he had the vision that he wants to play long term for India. And he ended up reaching there.
Entrepreneurship took center stage in a dynamic session on startups, the future of healthcare. Founders and leaders shared bold visions on how innovation, scale and technology are reshaping patient care and delivery models.
The healthcare breakthroughs for the last 25 years, a lot of it happened here in India. I have been involved in the healthcare industry for over 25 years, and most of the back-end coding happened in India.
You would see that in many cases, in urban setups, people would be skeptical about technology. But in the rural setup, when this kind of a mass level innovation happens, they are more receptive. They would start using it far more.
By definition, innovation will precede legislation. You cannot create a law for something which is not yet innovated, right? By definition, therefore, the regulation will always come after you've innovated, and you will always operate for some time in a gray zone, where you think you are going correct by the law, which is the existing law, and the regulators will always feel a need to regulate you.
Today, you can build technologies in a matter of weeks. Maybe you validate it in a matter of months. Tomorrow, that process may take days.
Policy leadership took the spotlight with a keynote by Dr. Sunil Kumar Banwal, IAS, who shared insights on India's journey towards building a digitally empowered health system through the National Health Authority.
When we talk of ABDM, it is basically creation of a high trust, low cost digital healthcare ecosystem using digital public infrastructure approach. We have all seen the success of UPI, and then we have started building more digital public infrastructure, which actually suits to our country requirement with such a large population and such a diverse population. Building a very proprietary license-based product actually doesn't work for a large size population, and therefore we build an ecosystem which works on digital public infrastructure. And we know the challenges are actually to build such system which is interoperable across all the stakeholders. So this is what ABDM aims for.
Next up, Dr. Sanjay Sood shared the journey of eSanjeevani, India's national telemedicine platform that is transforming access to care across the country.
India is not just participating in digital health revolution, but is leading it. And when we say it is leading it, the leadership is not just about numbers. It is about proving that digital health at scale is practically feasible, it is possible, and it is delivering.
Moving on, global nursing leaders came together for a powerful session on nurses redefining healthcare delivery. The discussion emphasized the critical role of nurses in driving innovation, patient-centered care, and digital transformation across health systems.
When we say the redefining the healthcare delivery system, it is more of an opportunity now when the World Health Assembly of 2025 extended the achieving the strategic direction for nursing and midwifery from 2025 to 2030 in view of the achieving the sustainable development goal for the universal health coverage. In that perspective, I think the ICN, International Council for Nurses, and the WHO has reinforcing to all the countries to improve the status of the nursing and also the quality of the patient care to the population.
We have a very important mission, is to go to the government, to go to the politicians and say, we have the solutions, please listen us. Being prepared is important. Knowing how to wait is even more so. But seasons, the opportune moment is the key to life. So nurses are prepared. It's our moment. Thank you.
We have heard about all these new things happening in the world, and also the expert explain. If we can incorporate digitalization and AI into the nursing profession, we can reduce our workload, and also we can find a solution to our work schedules and other challenges.
When you come upon the challenges, what are the challenges has been facing by the nurses in Nepal? Like the existing jobs are not matching with the production, and there are very few posts created in the government. It's long time back the posts are not created in the government, and we do have a lot of shortage of nurses.
I think it is very important for us to know what are the regulations that are existing for nurses and how you can work upon the regulations changes in the form of innovations. Today we went through an exercise of AI tools, how to use it, and when everybody else is doing it, then why not nurses?
How many nurse workforce we have in our country? We have 35 lakh nurses, we say. But do we have 35 nurses in India? We say it is since 1947, but how many are live registered? So enrollments is what? Who is registered nurses and are working in anywhere in the nursing home or as a nurse, she has to enroll herself in the NRTS, and it's free of cost.
Coming to the nurse practitioner in midwifery, from the beginning itself, we are part of that initiative, and we have supported Government of India and Indian Nursing Council to come up with NPM guidelines and curriculum for the nurse practitioner in midwifery. We have also facilitated a learning visit to British Columbia to understand about the midwifery model of care in Canada.
The summit also celebrated excellence through the Special and Innovation Awards. Individuals, government bodies and private organizations were recognized for their outstanding contributions to advancing digital health. Beyond the plenary sessions, Day 3 also featured spotlight sessions that brought scientific rigor, leadership insights and global collaboration to the forefront. Organized by the Academy of Digital Health Sciences with support from ICMR, the Digital Health Scientific Symposium showcased cutting-edge research from mental health apps to AI-driven cardiac care. With jury-led evaluations and a strong policy orientation, the symposium set a global benchmark for evidence-based, ethically governed innovation, while the top 3 winners were recognized with prize money for their impactful contributions. A closed-door leadership session by one of the world's most influential business advisors, Dr. Ram Charan, engaged CEOs and senior leaders on navigating digital transformation. The Global Health Connector Partnership Roundtable successfully activated its mission to connect people, organizations and ideas across the global health ecosystem. The GDHS Hackathon 2025 transformed 24 hours into a proving ground for young digital health innovators. Teams of students and recent graduates tackled real-world challenges from AI-powered diagnostics to chronic disease tracking and gamified mental health solutions. Guided by global mentors and tested through rigorous evaluations, participants coded, collaborated and pitched under pressure. The top 3 winners were awarded prize money, recognizing their creativity and impact and proving how the next generation is shaping healthcare's digital future. Dr. Rajendra Pratap Gupta unveiled the world's first AI functional pyramid framework for healthcare, a research-based mental model for AI, setting a global benchmark for embedding artificial intelligence into health systems and guiding how to transition across each level of AI deployment. With this milestone, the Global Digital Health Summit 2025 set the blueprint for shaping the healthcare systems of the future with AI. The Global Digital Health Summit 2025 also marked the launch of Tesla Edison ecosystem, a global movement to build the next generation of digital health leaders. Inspired by Edison, who succeeded by building an ecosystem, and Tesla, whose brilliance lacked one, this initiative focuses on what truly drives innovation, which is mindset. The Tesla Edison ecosystem is designed to drive innovation by bringing leaders and innovators onto one platform, creating the collaborative foundation digital health needs to thrive. At a time when misinformation clouds progress, the Global Digital Health Summit unveiled two landmark initiatives, Trust and Evidence. Trust Digital Health is a global newsletter curated by digital health leaders, delivering credible insights and clarity across borders. Evidence Digital Health is a peer-reviewed scientific journal focused on real-world data and validation of digital innovations. Together they embody what the world needs most today, trust and evidence in digital health. Alongside high-powered sessions, the Global Digital Health Summit 2025 featured an exclusive expo that became a showcase of the future. Global pioneers unveiled breakthrough digital health solutions from AI-driven platforms and smart devices to next-generation hospital technologies. For delegates, it was a first look at innovations set to transform healthcare delivery and redefine how care reaches people around the world. Beyond the formal sessions, the Global Digital Health Summit came alive at the Digital Health World Cafe, an informal, buzzing space designed to spark conversations that matter. Over coffee and open dialogue, clinicians, innovators, policymakers and entrepreneurs exchanged perspectives, built trust and discovered common ground. What began as casual chats often evolved into meaningful collaborations, proving that the future of digital health is as much about human connection as it is about technology. The summit drew to a close with heartfelt closing remarks and a vote of thanks by Ms. Mavish P. Vaishnav, President of Digital Health Associates.
Over the past 3 days, we set out to press the reset button for healthcare, to rethink, rewire, rescale for digital-first future. We called it the golden age of medicine. And together, we did not just talk about it, we lived it.
GDHS 2025 ended not just with applause, but with a sense of purpose that will echo far beyond the summit halls. Over 3 extraordinary days, the world's brightest minds came together to reimagine healthcare, turning ideas into innovation, technology into trust, and conversations into collective action. As the global digital health movement gains momentum, GDHS 2025 stands as a reminder that the future of healthcare is not just being discussed, it's being built right here, right now.
Today on The Interview,